Hospital in Drogheda. The Deputy has 4 minutes.
Thanks, Cahirlock. Firstly, I want to say it's just in relation to the matter of the removal of the X-ray room from the plans for the extension of the emergency department at Our Lady of Lourdes Hospital. But I had previously raised this matter with the Taoiseach under order of business, and the Taoiseach had said that he would refer it to the Minister for Health. And I've since sent correspondence to the Minister for Health, and I've had a response from neither. So it's very disappointing that the Minister isn't here today to answer. This is my third attempt at having the matter raised, and I suppose it's no wonder our public health service is the way it is when the Minister isn't here to respond to the very serious issue that I'm raising. Just a few weeks ago, the HSE took a decision to remove the X-ray room out of the plans, as I have said, for the extension of the emergency department at Our Lady of Lourdes Hospital in Drogheda. Now, these plans have been in place for 10 years. They were costed and included in the tender. The staff had been patiently waiting for almost a decade. Now, the medical people, the staff, the clinicians, the nurses, the radiographers, all of those people that work at the coalface on the front line have been crying out for years for the need for a second X-ray room, and this was accepted, and that's why it was included in the plans. There is one and only one X-ray room in Our Lady of Lourdes Hospital, and they're at full capacity. In fact, they're working beyond capacity. The equipment is 10 years old. It's obsolete, in fact. And the Minister would be aware that X-ray is a major diagnostic tool in any emergency department, in any hospital right across the state, and the only people that are going to suffer here are the patients, because building an extension to an existing emergency department is to cater for a higher turnover. But sure, how is that going to, how are they going to cope without a second X-ray room? I had said to the Taoiseach at the time, it's like building a house without a roof. It's sheer madness. Now, I presume the Minister had no act or part, at least I hope he didn't, but I'll take it that he didn't know of it, and this is just another example of HSE senior management ludicrousy. But what I wanted to ask the Minister, was he going to stand over this unbelievable myopic mindset and the sheer incompetence at HSE senior management level, and was he happy to ignore professional staff on the front line when they have cried out for years for the need for the X-ray room, and the fact that it was included in the plans? I mean, you don't plan something that takes nearly a decade to come to fruition and then pull a major part of that plan at the 11th hour. 3 weeks ago, in fact, well, they'd done. Now, I just want to outline some of the emergency departments, radiology departments across the state. The University Hospital in Limerick has 2 X-ray rooms. Cork University Hospital has 2 X-ray rooms. Beaumont 2, St Vincent's 3, Galway 2, Tala 2 plus 1 paediatric, Maher 2, Our Lady of Lourdes has 1. Now, Our Lady of Lourdes is the second biggest trauma centre in the state. Now, that actually came from the CEO of Ireland East Hospital Group. So it's the second biggest trauma centre across the state. Now, the extension, as I said, was planned. There's simply no excuse for it. There's no justification for it. So I'm looking to have it reversed.
On behalf of the Minister for Health, thank you, Deputy, for raising this issue and giving me the opportunity to provide an update to the House in relation to the planned new X-ray facility to support the expanded emergency department at Our Lady of Lourdes Hospital, Drogheda. The Government is committed to making tangible and sustainable improvements in our health services. This includes a major capital developments being completed in phases at Our Lady of Lourdes Hospital, Drogheda. Phase 2 of this project has already seen 29 ward beds open in December 2017. The Department of Public Expenditure and Reform governs the processes surrounding the development of healthcare projects by way of guidelines, principally the Public Spending Code. Further rigour is demanded by and set out in relevant EU directives. All proposed projects must be submitted to the HSE's Capital and Property Steering Committee for approval and prioritisation prior to inclusion in its multi-annual capital plans. The National Development Plan announced earlier this year as part of the Project Ireland 2040 policy initiative provides €10.9 billion for health capital developments across the country, including both national programmes and individual projects across acute, primary and social care. Health capital projects and programmes currently underway will continue. With regards to the provision of a second X-ray room as part of this project, my department have been informed by HSE Estates that this development had been discussed with service user groups. However, the second X-ray could not be delivered within the capital allocation for this project and as such has not been included in the project brief. An additional CT scanner is expected to be brought online in early 2019, which will see Our Lady of Lourdes equipped with the following imaging facilities: 2 CT scanners, 1 MRI scanner, 2 ultrasound rooms, 1 plain film. With regard to progress on this project, I have been advised by the HSE that the new emergency department, which will be located on the ground floor of the hospital, will be completed and available to open in early 2019. The HSE has further advised that there is some work still to be completed in the old emergency department to allow for the installation of a new paediatric emergency department and an extension to radiology services. The HSE anticipates that the full extension will be ready in early 2019. Further important capital developments expected to be completed at Our Lady of Lourdes Hospital in the near future. These include 29 ward beds planned to open in January 2019, further 24 additional ward beds and a theatre suite comprising 3 fully equipped theatre rooms are due for completion in the second quarter of 2019. The Department, HSE, RCSI Hospital Group and Our Lady of Lourdes Hospital are supportive of this project, and the need for this capital development is recognised in supporting the delivery of key services to patients served by Our Lady of Lourdes Hospital in Drogheda and the surrounding area. As the Deputy will be aware, the new emergency department is a part of the major capital infrastructure project that is taking place at Our Lady of Lourdes Hospital, which includes additional beds, theatres as well as the expanded emergency department.
Deputy Munster, 2 minutes.
That's some response, but what it tells you there is that the Minister is quite happy that plans that were in place for 10 years to put an extension on the emergency department is to go ahead under the Minister's watch without an X-ray room, like building a house without a roof, as I said. How can the Minister actually stand over this? I mean, that's just typical HSE spiel. Like, what's in that? He's saying there are 29 beds. We know that, and that's welcome. But of course, when you extend an emergency department, you're going to have more patients coming in. And 80% of patients that go through an emergency department need some sort of X-ray or scan. Now, I've said till I'm blue in the face that the existing one is working beyond capacity and the equipment is obsolete. Now, Minister Harris, despite your programme for government and investment in capital funding in our health service, this is just rubbish. It's absolute rubbish. You're actually extending an emergency department without putting in a badly needed X-ray room that was included in the cost, that was included and costed in the tender. So why was the money pulled? Why was the money pulled at the last minute? Why was that pulled? And where does patient care come into this? I'm not going to let this go. I'm seriously not going to let this go. It's pure and utter madness. And the next opportunity I get with the Minister, I'm going to raise it again, because this is just ludicrous. This is not putting patients first. And anything that you say in your programme for government is baloney when this is the real action that you take, when you're prepared to stand over this sort of ludicrousy. It's unbelievable.
I'm not sure really what state the Deputy she has made her case. I have just outlined, I think, almost, if you were to add up the totality of the developments that are taking place at Our Lady of Lourdes Hospital in Drogheda, is totalling almost €40 million. If you think that's baloney, that's a matter for yourself, Deputy. I'm not going to. I didn't interrupt you, Deputy. So please allow me. Sorry, Deputy, I didn't interrupt you. If you consider that baloney, that's a matter for you. I think it's a very significant investment. The Deputy may not be aware, but there is a limited pool of resources available for the developments that we all seek in all of our hospitals, the length and breadth of the country. Councillor, I'll either leave the Deputy speak or I'll continue to speak, whichever, but I won't speak while the Deputy is speaking over me. We all would like to see many improvements to our local hospital network, and we're all fighting and championing, and that is your right to do that. But you also have to respect and recognise and acknowledge the contribution that is being made to the hospital and to the well-being of the patients that use that hospital is very, very significant. It's not everything that you want, and that's fine. That's your entitlement as a public representative for the area to highlight that it's not everything you want, but you can at least have the good grace and the decency to acknowledge the very, very significant contribution that is being made to the hospital. But we are working within a finite budget. There are limited resources there. We don't have an endless pot as much as we'd like to have it to give everybody everything that they need. Cormac, last thing, Cormac.